The expansion of COVID-19 vaccine eligibility to everyone age 50 and older will be the biggest test yet for California's vaccine effort, which has stabilized recently but still faces questions about whether supply and appointments can keep pace with demand. Millions more Californians qualify for a shot starting Thursday, and in 2 weeks, all residents 16 and older will be eligible. For most people, actually getting a dose will involve wading into California's vast array of appointment websites run by local health departments, private health providers and clinics, several major pharmacy chains in the state, through a portal called My Turn. Public health officials are urging newly eligible people to be patient while searching for an appointment because the supply of vaccine doses coming from the federal government is still constrained in some places. Officials in several major counties have said they could vaccinate far more people if they received more supplies. Officials in Los Angeles County estimate it has the capacity to administer 700,000 doses per week, but supplies have yet to reach that level. It's impossible for us not to be alerting people to the fact that they are going to perhaps need to wait for a couple of weeks before they're going to be able to get those appointments, LA County Public Health Director Barbara Ferrer said Wednesday. An estimated 1.4 million L County residents will become eligible April 1st, and nearly 4 million people ages 16 and older will become eligible April 15th, Ferrer said. Across the state, more than 30% of residents have received at least one dose of the vaccine, totaling more than 18 million doses. State and local officials have continued to prioritize equity in the vaccine distribution, a key to the state's reopening plan, but ongoing constraints in supply could further hinder those efforts to reach the hardest-hit communities. In Los Angeles, Ferrer said capacity is not going to be a limiting factor. As soon as there's an increase in doses, we're going to be able to translate that immediately to more appointments for people who are eligible to get vaccinated, she said, noting that the county this week received fewer than 400,000 doses, which limited the number of appointments it could provide. Officials have been relying on an influx of doses in April to keep pace with the growing eligibility, with Ferrer on Wednesday projecting that if L could continue to acquire 576,000 or more doses per week by the end of April, more than 80% of the county could be vaccinated by the end of June. Yet Johnson & Johnson said late Wednesday that a batch of vaccine failed quality standards and can't be used. Ferrer said L County had been anticipating that about 20% of its doses over the next 3 months would be Johnson & Johnson. The drug maker didn't say how many doses were lost, and it wasn't clear how the problem would affect future deliveries.